ให้มีภาวะที่เป็นสุขก็คือทุกสิ่งทุกอย่างนะครับให้สมาชิกครอบครัวเขาอยู่เป็นสุขให้สามีของเขาไม่เที่ยวกลางคืนไม่ดื่มสุราให้ภรรยาของเขาได้ช่วยเหลือเป็นแม่บ้านบุตรหลานของเขาได้มีที่เรียนอยากให้ครูมาสอนเด็กอ่านออกเขียนได้สอนให้เขามีคุณธรรมจริยธรรมก็อยากให้อบต.หรือเทศบาลเนี่ยครับจะได้จัดสรรงบประมาณทำในเรื่องพัฒนาคุณภาพชีวิตอยากให้กำนันผู้ใหญ่บ้านมามีส่วนร่วมกับอบต.กับชุมชนเยอะแยะรวมๆก็คือทุกคนทำตามหน้าที่และจะมีจิตสำนึกสาธารณะทำให้ทุกอย่างมันก็ฝันจะเป็นองค์รวมของความสุขนะก็แค่นั้นนะหวังแค่นั้นนะ
อยากมีสุขภาพที่ดีแล้วก็สุขภาพที่แข็งแรงนะคะไม่มีโรคภัยไข้เจ็บจะอยู่กันสบาย
ถึงแม้จะไม่ร่ำรวยสักเท่าไรแต่ถ้าเรามีสุขภาพดีด้วยร่างกายสมบูรณ์เราพร้อมที่จะประกอบอาชีพได้อย่างแข็งแรง
Health means holistic well-being, which is something that everyone deeply desires. But well-being requires all the important parts of life to be balanced and in harmony. The happiness of Thai people is therefore not something which will come about easily. There are many examples of situations which have developed into major conflicts. When we build a road which links up with a road network, building an efficient transportation network, we hope it will provide the basis for supporting development towards modernity. However, the impact could be that more people die from traffic accidents or become disabled and unable to work and spend the rest of their lives as a burden to their families. Seeking to achieve economic development through stimulating consumption has accelerated the resurgence of diseases such as diabetes, high blood pressure, and cardiovascular disease. The numbers of sufferers have increased in line with increased consumption. Promoting investment in heavy industry has brought enormous amounts of capital into the country and has created a massive increase in employment. However, it has cost us the destruction of our environment, the depletion of natural resources, and has caused the ill health of people who live in industrial areas. The same is true of development policies which use the economy as the driver and focus of development. They have caused a change in agricultural practice from subsistence farming to commercial farming. This can be seen in single-crop agriculture, which uses enormous amounts of chemical pesticides and insecticides, which have caused the accumulation of toxins in soil, water, and food. These in turn result in both producers and consumers suffering from chronic illnesses. Because everything is interrelated, dynamic, and interconnected, a single change affects everything else. Aiming to reach a positive goal of creating a well-being society thus becomes difficult and complex. It requires an effective process and good tools. Over the past 10 years, there has arisen a movement for health system reform, which has encompassed government agencies, civil society, the private sector, and local communities. They have collaborated in a learning process through the Forum of Health Assemblies at 3 levels. This has brought change to the healthcare system, the establishment of a learning network, holistic knowledge, a National Health Act, and the Statute on the National Health System 2009. This is a major piece of legislation which was formed with the participation of various different sectors of society. It is important legislation which can work as a tool to integrate power from different sources and build well-being. Put simply, the Statute on the National Health System can be seen as an elaboration of the theoretical ideas of the National Health Act, working to build the intention of our whole society to make health our highest priority. The strategy seeks to specify the main direction and select the development methodology which will propel Thai society through consumerism towards a sufficiency economy. The hope is that the final income will be a healthcare system which enables the public to depend upon themselves and which is balanced and sustainable. In practice, the 111 sections of the 12 chapters of the Statute on the National Health System represent a body of knowledge gathered from the working experience of various sectors of society. This shows the interconnectedness of important issues which need to be worked on in an integrated fashion, with different sectors working in parallel. It works as a roadmap to identify both the destination and the starting point. It functions as a plan showing the method by which all parties can start to travel this path together. Some examples of important points can help to visualize the whole picture. Section 4 of the first chapter states that good health is a basic right of the people. From birth to death, Thai people should experience well-being in all 4 dimensions. This right is linked to the duty of everyone to participate in the process to establish a good health system. This process will lead to the harmonious participation of all parts of society in providing health security for all. The role of government agencies is very important, and they must ensure that they do not formulate policies which may damage health. Government agencies must also fulfill their roles of both creating public policy, which can help to build good health, and actively putting those policies into practice. Numerous clauses and chapters of the Statute on the National Health System refer to enhancing opportunity and equality. This is not just idealism, because the statute also shows the methods through which this can be brought about in reality. Given limited national resources, this must be achieved through good investment management. This means the knowledge which comes from the practical experience of different sectors of society. The result of many years of work on quality development has led the Thai Health Service to discover that the very heart of effective work is the establishment of a humanized system. Placing value on helping our fellow human beings is an effective goal to draw creative capacity from personnel at all levels. This attitude has become a positive force, increasing the efficiency of the whole system. This has spread from the inside to become part of the process of development. This will help to build the capacity of the healthcare system to be prepared to offer a high-quality response to the heavy burdens and obstacles which it faces. Another important issue is proactive work to reach out to families. Assigning a family doctor to regularly visit and monitor the health of family members creates a long-term relationship of comprehensive care. Visits will also encourage relatives to participate in taking care of ill family members themselves. Relatives will receive support to build their health care knowledge as well as receiving medical equipment and moral support. The goal is to empower family self-reliance and to develop families' ability to provide long-term care for chronic patients in their own homes. Provincial government authorities, municipal councils, and sub-district administrative organizations are experiencing change in the distribution of authority. These key agencies must use policy, budget allocation, and the welfare system to generate opportunities for people who currently lack them. They must promote the traditional values of helping one another, generosity, and interdependence. This should be combined with the work of public health volunteers who have increased their numbers and developed the quality of their work and are an important factor in the creation of a strong local community healthcare system. An important subject covered in detail by the statute is the plan to establish Thai traditional medicine hospitals. This will provide an alternative to expensive Western medicine, which imposes a heavy financial burden on the existing health system. A thoroughly researched process will rehabilitate and reuse indigenous knowledge accumulated by our ancestors. This provides an opportunity to collect and preserve local wisdom, which was being lost. This knowledge can be developed into an holistic health resource for Thai society. This knowledge can serve as a basis to become self-reliant in health in the future. These few acts and sections of the Statute on the National Health System progressively connect health issues with development issues. This shows how all the important issues are connected in the front line of change. This is a wave of change driving Thai society forward one step at a time, through a process of learning and implementation. The practice of this process will see progressive improvement and development with each success it experiences. The statute clearly sets out the process to review and improve the content of the statute at least every 5 years, reflecting the fact that this is a collaborative learning process based on practical experience. This process will integrate positive experiences and examples in order to build a healthcare system which is based on collective knowledge and collaborative effort rather than one dictated by the authority of just one sector. It seems difficult but is easy to understand when one actually does it. The people of the subdistrict of Chalat provide a good example. They rose up and organized the process of writing Thailand's first community statute on the health system. Living our lives in accordance with our most worthy duty, that of building a system to care for every citizen, is a beautiful thing, and one which is conducive to our happiness. The healthcare system has brought all parties involved a proud satisfaction and happiness since the start of our collaboration. The statute on the national health system is a useful mechanism to transform the common interest of people into a driving force, to resolve problems, and to turn crises into chances to develop. The statute on the national health system is a tool and mechanism to invite people from all sectors to participate in a process of collaborative learning during actual implementation. With collective collaboration, determination, and with a commitment to walk hand in hand along this long path together, we will be able to put in place for tomorrow the health system we have all wished for.